And now my next task is to introduce our very first panel, the special panel of global health leaders who will discuss driving action to address climate change across the globe. Moderating this panel will be Judith Rodin. Judith serves as the National Academy of Medicine's Climate Grand Challenge Steering Committee. Judith has previously served as president of the Rockefeller Foundation and president of the University of Pennsylvania. So Judith.
Well, I'm delighted to be here and absolutely delighted to see all of you. And you hear already the enthusiasm around the agenda that we all share and the excitement of what we are hearing today, I think will go out and escalate as we continue to move all of these great ideas forward. But it is terrific, finally, to have a Climate and Health Day in the U.S. Climate Action Summit. So thank you very much for your team really recognizing and continuing to accelerate the demonstration of the importance of this nexus. There's been a lot of progress this year. Finally, it has been a pretty extraordinary year, from all of the agenda items that we just heard from Ali, and certainly the investments that will be made over the year, but also how we move forward from COP28, where we had our first Climate and Health Day, and the recognition of the global community of the pressing, truly pressing moment upon us as we recognize this nexus. I'm very honored to chair the National Academy of Medicine Grand Challenge on Climate Change, Human Health, and Equity. Victor will speak more about that today. And we have several members of the various working groups from that Grand Challenge effort. And we invite so many of you to continue to work with us as we move those agendas forward. We have a great panel to kick off our afternoon, and we thought we would start broad and then narrow with successive panels. So in our first panel, we have chosen fantastic representatives from so many important sectors: the philanthropic sector, the U.S. government, the private sector, the great multinational finance organization. And we'll hear from each of them not only what they're doing, but I think what they think is important and why they think it's important as they push these agendas forward. I'll just talk about a little bit for a moment of the exciting progress that each of their organizations has made and what it really represents. In 2023, the Rockefeller Foundation announced that it will invest over $1 billion in the next 5 years to advance the global climate transition. It's very near and dear to my heart as an organization, and I'm so excited and really pleased to see this momentum moving forward. In the U.S. government, the Office of Climate Change and Health Equity within the Office of the Assistant Secretary of Health was created only a couple of years ago. John is the first incumbent leader, but recognizing that we need substantial resources to bolster and to increase health sector resilience and sustainability broadly in our nation. The World Bank is at the forefront of financing climate action, and recently it announced a new climate and health program at COP28 to urgently respond to the negative health impacts of climate change in low and middle income countries. Our language has so often and appropriately focused on mitigation, but in low and middle income countries, it's really adaptation and resilience that are the pressing issues, particularly at this nexus of climate change and human and animal health. AstraZeneca has been really an extraordinary leader and partner at the forefront of so many of these efforts. And the CEO, Pascal Soriat, chairs the Sustainable Markets Initiative Health Systems Task Force. It's a public-private partnership that accelerates the decarbonization of health systems. We'll hear from each of the panelists today about the opportunities that they see have been accelerated by the actions, the surge of legislation and investments that we heard a bit about from Ali, events leading up to COP28 and COP28 itself, and what will come forward in 29 and 30, in addition to other global events that are now focusing on this intersection. I would just say before I introduce the panelists that I hope each of us is committed to really reflecting on, as we hear the panel discussions, and you will have a chance in each one to make comments and ask questions because all of you are experts, to think about how we can come away from this accelerating the momentum. We don't want each meeting to be a redundant sort of discussion of what the last meeting really covered. We would like each one to be the springboard for the next accelerated progress and momentum and multiplicative momentum. That is, if we stay in silos, we're not going to have these multiplier effects that I think will really move things forward. So how do we support one another's work, from financing to technological innovation to research and policy change? In each of those, we are so critically in need of real collaboration and real momentum. And so I urge each of us to really make sure that we come away with that commitment as well as the substantive knowledge that we'll definitely garner from the very rich discussion. I'm going to introduce very briefly each of our panelists and then ask them to simply come one after the other so that we can be more efficient. Our first speaker will be Dr. Naveen Rao, who's the Senior Vice President of the Health Initiative at the Rockefeller Foundation. He's leading the foundation's efforts to shape the field of climate and health, trying to transform, among their many initiatives, the world's health systems to be more equitable, inclusive, and resilient to climate change, and improving the ability to predict, detect, and respond to climate-sensitive disease threats. Next speaker will be Dr. John Balbus, who's the director of the HHS Office of Climate Change and Health Equity. He is formerly the Deputy Assistant Secretary for Climate Change and Health Equity, and he has served as the principal from HHS to the U.S. Global Climate Change Research Program and chairs the subgroup on climate change and human health. Pam Cheng is the Executive Vice President of Operations and Information Technology, as well as the Chief Sustainability Officer at AstraZeneca. She guides the company's manufacturing, supply chain, procurement, IT, and sustainability efforts across 18 countries, leading a team of over 20,000 employees. And our last speaker will be Dr. Tamer Rabie, who is the Global Program Lead for Climate and Health at the World Bank. Tamer joined the World Bank in 2005 and has been leading its efforts in lending as well as advisory services across more than 30 countries across all regions of the world, especially those that are characterized by fragility, conflict, and violence. And so he's been at this climate and health intersection for a very, very long time. Naveen, let me turn this over to you.
So if the first panel is supposed to be broad, then by definition the first speaker is supposed to be the broadest. I will do my best. Thank you, Judith. Thank you, National Academy of Medicine, Kaiser Permanente Climate Fund. I want to take you immediately back to the summer of 2021, when Trevor was trying to get his grandmother, who lives in Houston, a COVID vaccine. He'd heard on the radio that President Biden had said that every American will have access to a COVID vaccine within 5 miles. But it was really hot that summer, and Trevor wasn't sure he could walk his grandmother those 5 miles because he didn't have a car. Also, he didn't want to take her on public transportation because he was worried she was diabetic, asthmatic, and at high risk for COVID. To cut a long story short, despite his best efforts, he was not able to get his grandmother the vaccine, and she died that summer from COVID. We at Rockefeller try to remember this is why we come to work every day. Vaccines don't save lives, vaccinations do. Access, equitable, putting your heart in the right place, this is what makes it all worth it. We need to be there for the Trevors and their grandmothers. For over 110 years, Rockefeller Foundation has been dedicated to the well-being of humanity, and our founder, at the start of his activities, coined the term scientific philanthropy. Excuse me. And his concept was science was at its start of the evolution of understanding disease, and he wanted to make sure that he had evidence-based and scientific-based philanthropy. Today, we call that big bets at Rockefeller Foundation. And there are 3 elements, as my colleague here today reminded me, it's a 3-legged stool. And we have 3 elements that we look at when we define big bets. The first is innovative solutions that are really bold and big. The second is we want to make sure we have unusual alliances, bring in people who are not at the table. And the third is be very, very rigid and fearless about measuring and holding ourselves accountable to human impact measurements and outcomes. So today, what I'd like to do for the rest of my talk is give you some examples of what we're doing in these 3 areas at Rockefeller Foundation: innovative solutions, data, measurement, and unusual alliances. I have a whole list of headwinds here, but I'm going to go past them because we've all heard about the existential crisis, climate change, about where we are in the political landscape and in the election cycles. So I'm going to skip all the headwinds, as they say in the United Nations, all protocols observed. I'm going to say all headwinds observed. What I want to talk about is why we at Rockefeller are excited about the future, why we see the glass as half full, and it is that we are seeing really exciting initiatives emerge at the intersection of multi-sectorial organizations, quite a few of who are here today. And it's this coming together of unusual partners and coming up with innovative solutions that is getting us excited. So the first example is about dengue. And as you know, climate change is increasing the risk of multiple health issues, including particularly mosquito-borne diseases. We have a partner in India, Artificial Intelligence Robotic Technology Park. It's a beautiful name. Basically, it's called Art Park. It's an NGO in India that is fearlessly exploring how to use artificial intelligence in the service of climate change exacerbated health diseases. what they were able to do is work with stakeholders in the country, and they particularly in a state, southern central state of India called Karnataka, where there was a huge dengue outbreak. They were able to analyze decades worth of data, but triangulate that with mobility, triangulate that with weather change patterns, and come up with a platform that would allow them to forecast dengue outbreaks. And I've seen this in action when I went there. They had a map of Karnataka showing where the current dengue outbreaks are happening in the subregions in that state. And then they had another slide showing where the platform is saying the future are going to be. And it was amazing that there was one part of the state that did not have dengue today, but in 6 months was going to be the flashpoint. And those 6 months allowed them to get the vaccine, allowed them to get the communications and the necessary equipment to that place. So there is value in this. So the first is an example of innovative solutions. Now they're in discussions with the national government to see if they can go beyond dengue and beyond Karnataka state. So that's example number one, speaking to innovative solutions. The next example I want to talk about is on data and the work that we can do to better understand at the front line where the vulnerabilities are. And I'd like to use an example about our work with SEED Global Health. Now, I'm not doing this about SEED because Vanessa is within striking distance. And if I don't say it properly, I probably will get that elbow in my side. But I really do want to talk about our work with SEED Global Health as an example of how important it is to be able to get the communities to commit to working together with us to be able to find out where the vulnerabilities are. So there's an old axiom that says what gets measured gets managed, and this is really true in the emerging field of climate and health. SEED is developing diagnostic tools to assess health system vulnerabilities and shape solutions. For example, in Malawi, country systems are still rebounding from Cyclone Freddy and other extreme weather events. So SEED's tools are helping their decision makers quickly assess and address those vulnerabilities and keep their health systems responsive. This data creates an evidence base for linkages between climate change and health, serving as a baseline against which changes in disease risk and protective measures can be implemented and monitored. It'll also allow countries like Malawi to attract external funding. So data, where are the vulnerabilities, where are the risks, how can we focus our attention and to talk about how can we get unusual partners to come in and work in unusual ways, because what we're doing currently will not get us where we want to do. Doing more of the same won't get it done. So the example that I wanted to give was about the importance of data and how we're working with communities on their data, on their vulnerabilities. So it's an inside-out view, not an outside-in view. And that's hugely important. And the third example I want to give is about unusual alliances. And so this, the example here I want to give is that when we went on asked on a listening tour, we heard that financing is a huge problem, and there are basically three problems in financing. One, there's not enough, especially when it comes to adaptation, climate change. Second, even when that money does get to the countries, it's going to the countries who know how to apply to it and who know how to get to those forms and have the connectivity. And usually those are not the most vulnerable countries, so it's not going to the right countries. And third, even when it gets to the right countries, it was very hard for those people to access the money. So financing is a nightmare. So our vision was very simple: to make access and financing easier and more equitable. So we worked with the COP28 presidency and the Global Fund, the Green Climate Fund, and the World Health Organization to develop a shared set of 10 financing principles. In this process, we consulted with over 50 organizations and forged unlikely alliances with groups that normally work in silos. Climate funders, health multilaterals, development banks, philanthropies, donor countries, low and middle income countries, and civil society. We were able to get all these people together, and I'm pleased to say that about 40 organizations, including the World Bank and Wellcome Trust, et cetera, have signed on to endorse the guiding principles. And in total, the guiding principles framed more than $1 billion in climate and health financing commitments made at COP28. So this is an example of the third example of what it takes to do a big bet, is to get unusual partners to come together and have a common commitment. So if we do this right, we will close the $10 billion annual gap in adaptation and financing. And while it's tremendous how many organizations have signed on, we have still a lot more to do. 3.3 billion people worldwide are highly vulnerable, and they can't wait for COP29 and COP30. We need to act now. We need to use this momentum, and we need to get tools into the hands of the people who need them the most. People like Trevor from Houston, a city that already hotter than a decade ago. We owe it to them to fix the cracks in our global health system, making it stronger and more resilient to climate change. And we can do it if we work together. And so let's make this happen. Thank you.
I'm going to start serving this half of the room and stay here seated at the panel. Good afternoon, everybody. I'm John Balbus. I'm the director of the Office of Climate Change and Health Equity, and it's a pleasure to be with you today. I want to start by thanking Dr. Zhao and his staff, thanking Bashar and the staff of Kaiser Permanente and Adam and the Climate Group for creating this moment today. And also, I want to express the regrets of the Assistant Secretary for Health, Admiral Rachel Levine, who would be here if she could on this panel, but she has a very important other obligation. And for those of you who may have seen Secretary Becerra speak on Monday on Earth Day in an interview at Johns Hopkins, I won't say I'm here in his place, but I would say that he would love to be here at this table as well, and has such commitment and such support for the work that we are doing. So I want to invoke their presence as I speak. So this is a special day, right? This is a Climate and Health Day, the first ever Climate and Health Day at a Climate Action Summit. And I want to just start by acknowledging and invoking this moment. This moment is actually, of course, one of a series of really special moments and markers. There's today, there will be Climate Week when we have a health vertical. There was COP28 when we had a health day and a health ministerial. And in fact, there was COP26 when we actually had a very momentous event where 52 countries, including the United States, made a pledge to climate action. And each of these, I mean, each one, you know, we've had enough watersheds that we've solved drought problems, but you know, each one is a marker of what really truly is a transformational change, where you know, climate change is moving from being something that thought leaders like Kaiser Permanente has been working on for a long time. You know, the leaders in the private sector or in institutions like the U.S. government, it's been the venue of environmental health. So the CDC's environmental health arm, the NIH's environmental health arm. But what we're seeing is this transformative change where climate change is going from being somewhat of a side thought for the health sector to being mainstreamed. And I want to invoke the moment that this is happening, because this is not an easy thing for the health sector. Coming out of COVID, the health sector is extremely stressed. It's stressed financially. Many institutions are on the verge of bankruptcy. It's highly stressed from a workforce point of view, with tremendous loss of workforce. Highly stressed right now by cyber attacks, like the attack on Change Healthcare. And if Secretary Becerra were here, he'd be thinking about all of these things. Luckily, I don't have to. And it's also stressed by climate change, and that is being acknowledged. So with all of this, I want to just kind of invoke a metaphor where I think we are, where, you know, for, you know, for 10 years, 15 years, I've been at this for 30 years, there has been a real push to raise awareness, to say that climate change is a health issue, to say that the health sector has an important role. And in some ways, all of this effort has gotten us to the point where we now have the train on the tracks. And we've started loading up this train. The train is almost fully boarded, and it's sitting there, but it's not quite rolling yet. And this is the moment. This is the movement, right? It's phase 2 of the movement has to be the movement of the train. And this is the group that has to get the train rolling in this room and on, on the remote viewing. So that's where we are. COP28 and what happened at the Health Day, at the ministerials, was huge because it was for the first time we had nearly every country in the world have health ministry representation there and make a commitment. So COP28 was about commitments to action, right? COP26 was about a commitment. We made a commitment at COP26 to decarbonize and make the health sector resilient and to work on community resilience as well. And commitments are really, really important because what those commitments have done, and especially to have health ministry show up and make this commitment, it's norming the intention. It's making the intention to act on climate change mainstream. Goes back to what I was saying, we're seeing this, and I'll talk about what's happening in HHS because we've been at this now for 3 years, but we're seeing it in all kinds of places where the climate change and health issue is, you're not looked at askance if you say, we have to be thinking about this. We have to be thinking about our greenhouse gas footprint. We have to be thinking about our extreme weather resilience. That's the change where we are. But of course, norming intent is important. Now we have to norm execution. Now we have to norm action. And we're not quite there yet. And what does that action look like? Well, the Action Collaborative, very well named, has kind of set out a pathway, which is a pretty good pathway, right? First step, accountability. Doing greenhouse gas accounting, reporting them publicly. We're working on this. Within HHS, of course, we launched our pledge with the White House, our health sector climate pledge, 2 years ago. Of course, in the federal government, we are not yet at the place where we can require reporting, but that is a voluntary encouragement of all of our pledge committers to be reporting their greenhouse gases, initially scope 1 and 2, and we just put out guidance for scope 3. Even more exciting is what happened in terms of reporting a couple of weeks ago, where CMS in its proposed inpatient rule released a novel model called the TEAM model, which is calling on voluntary engagement in this program to be accounting and reporting on greenhouse gases and reducing them, especially in the setting of surgical operations. So this was the first time that CMS had ever proposed greenhouse gas accounting. That's a big change. That's a real watershed moment. So action is at least reporting, but more than that, it's starting to invest. It's investing in decarbonization and resilience, and so this is why we in our office are focusing so much on the Inflation Reduction Act, and we've just completed what we called a catalytic program, 13 weeks of intensive webinars and breakout groups, which we have recorded and will make available in pieces and I'll talk about that more in a second, to help the health sector access the funds of the Inflation Reduction Act. It's also investing in community resilience, and this is going on in a lot of different ways. Of course, the Inflation Reduction Act has $3 billion in community resilience with EPA, but is it really down to 2 minutes already? But we're seeing incredible leadership in the healthcare too. The model like the Boston University model, where they are not only providing a solar panel and a microgrid for their health system, but also for surrounding community. We're seeing this in the community health centers, in the National Association of Community Health Centers through its CHARGE partnership. Just got a very large grant from the Department of Energy to do something similar in the Southeast United States. And the fourth thing that action really looks like is the breadth of engagement, at least as an initial step. And so within HHS, I hope everybody has seen our supplement to the HHS Climate Adaptation Strategy, which has accomplishments and commitments from every single division of HHS. That is a first time that that's ever happened, and we are also convening a federal health systems learning network. So we have engagement of all the federal health systems sitting down together, working on decarbonization and resilience. With all this work, we're seeing a few things that this group can really address and try to take action. There is this intent, there is a great appetite for decarbonization and resilience, but we're seeing really variable ability to be able to access those funds for a variety of reasons. We're seeing a lot of commitment. We're not yet seeing the payoff in the reductions, and so we need to be moving that along. And we're seeing that communities around the country are increasingly being affected by manifestations of climate change, heat as a primary example, and the communities are taking the lead, right? The communities are starting to mobilize. So we're seeing action plans at the city and at the local level. We're seeing Arizona now has a heat officer joining Miami, which has a heat officer. The communities are moving on their own, and the health sector needs to be there in lockstep with the communities. So in closing, I'll just say, yeah, I'm looking at, well, there goes the time.
It's okay.
We're trying to model this accountability. We are working very closely with regional partners, with state partners. But we've come very far, but we still have a long way to go, and I think we all acknowledge that. And so this movement starts with those who have made commitments, keeping those commitments, and that's what I want to close with. There are many in this room who have made commitments in various venues, whether it's an NGO, whether it's our own climate pledge. We need to keep those for our own transparency, for our own accountability. The movement requires two-way communication, right? Between communities and the institutions that serve them, between the government and the private sector, to be able to recognize we don't exactly know how this is going to play out. We don't know exactly how this is going to work. We're going to have to iterate this, and we're going to have to share the barriers, share the successes, and tweak the system as we go along. And then lastly, perhaps most importantly, we need the continued leadership of the health sector. And we have had decades of individual leadership. We've had institutional leadership of certain institutions. That has to continue because that's what's gotten us to this point. But now we need that sectoral leadership. We need the health sector to be seen as a leader in the climate space to achieve what we all want to see happen. So thank you for your attention.
Yes, so Pam Cheng from AstraZeneca here. So as John said, we've got this gigantic clock in front of us. If I start to speak faster and faster, because it's getting to zero. And I kind of know why Naveen went to the podium, because he doesn't have to see this. But anyway, thank you, Judith, for the introduction, and thank you, Victor and Bashara, for the invitation. It is quite a privilege to be a part of this esteemed panel and on this such an important topic. Now, the climate crisis is one of the largest public health crises of our time. Its impact is being felt by millions of people around the world. And for the first time at COP28, we made the connection between climate and health and recognized that this is a problem for today, not tomorrow. Now, if anyone in this room or online needs to be convinced that the climate crisis is having a devastating impact on human health, let me share some data and insights. Each year, more than 7 million people die from air pollution. Additionally, more than 5 million people die every year from extreme heat. In a Lancet Countdown report last year, It is estimated that if the global average temperature rises by 2 degrees versus the pre-industrial levels, the number of heat-related deaths each year will increase by 370%. Now, heat-related death of people older than 65 has already grown by 85% since the 1990s. It is also estimated that another 130 million people will launch into extreme poverty due to climate crisis. Furthermore, in line with what we do in the life science industry, respiratory disease, lung cancer are among the most impacted by climate change. At AstraZeneca, we understand the interdependence between healthy people and healthy planet. There's no such thing as healthy people if the planet is not healthy. As a healthcare company, we are decarbonizing from the lab to the patients, and we really strongly believe private sector can and should play a role in the fight against the climate crisis. We have pledged $1 billion in our Ambition Zero Carbon program started in 2021 to achieve net zero for scopes 1 and 2 by 2026. Yes, 2026, and we're sitting in 2024, with a 98% absolute reduction in emissions. Now, as Judith introduced me, I also have manufacturing and supply and procurement and IT at AstraZeneca, so I feel the pressure. Now, this is not just a bold ambition we set. I want to share with you, since 2015, year to date as of end of 2023, we have reduced our scope 1 and 2 emissions by almost 70%, 69.6 to be exact. Thank you. And we also aim to achieve 50% absolute reduction of our scope 3 emissions by 2030 and achieve net zero before 2045. We also pledge $400 million in our AstraZeneca forest and biodiversity projects. So we are now transitioning to renewable energy around the world, starting with biomethane in the United States, in the UK, and in China, wind power in Sweden, and solar power in many parts of the world. Now, while greatly important, decarbonizing our supply chain is not enough. As John had pointed out here, globally, including here in the United States, overstretched health systems are struggling to meet the demand, and it's growing, and the changing burden of disease, fueled in part by the climate crisis. Health inequities are also growing, and the vulnerable population continues to be the most impacted. We urgently need to strengthen health systems so that they are sustainable and resilient, and we need to transform how care is delivered so that health outcomes improve and are equitable while the impact on the environment is reduced. So how do we do that? We really need to recognize health is an investment for our future, not just a cost to be managed today. We need to act early to prevent, diagnose, and treat disease early to improve health outcomes while reducing the environmental impact. Build climate resilient, net zero health systems so that we can both mitigate our impacts and adapt the changes of climate crisis. Many of these topics were part of the dialogue during Health Day at COP28, and it is clear that progress is being made to turn commitment to action, as John said, but much more remains to be done. Looking forward, partnership is essential to ensure the climate and health nexus is being addressed effectively and efficiently and equitably, with a focus on vulnerable populations. No one organization can do this alone, and we must partner publicly and privately to ensure we get it done. Naveen, your opening remarks and Trevor's story really resonated with me as I think back on my own experience during COVID-19. I had the privilege of leading the development, manufacturing, and supply of over 3 billion doses of COVID-19 vaccine. And very proudly, we supply at no profit during the pandemic around the world. I remember that high of working with hundreds of people within AstraZeneca and hundreds more within our partners. That high of doing something good for humanity. That high, thank you. And although stressful, but that inspiring feeling of working at that enormous speed and scale. So the question is, how do we harness that speed and scale so that we can move at pace and harness that spirit in addressing the climate crisis? So I see my clock moving here. So I just want to highlight two important partnerships that are making difference in the fight against climate change and also the driving a net zero health system. One is the SMI that Judith mentioned, the SMI Health System Task Force, which is chaired by my boss, the CEO of AstraZeneca, Pascal Soriot. It's a collaboration of global health leaders from the public and private sectors committed to accelerating and transitioning to net zero healthcare systems. A couple of good examples. One is SMI is actually driving multi-party agreements to have access to clean energy across many key markets. These power purchase agreements allows companies and suppliers to have access to clean energy at scale at the right cost. Another example of SMI is actually they've issued a joint minimum sustainability target, urging suppliers to play their part in decarbonizing the healthcare value chain. The second example I want to give is the Partnership for Health System Sustainability and Resilience. It's a mouthful, PHSSR for short. It's the other partnership that I want to highlight that is making a true difference here. It's a collaborative effort live in 30+ countries where it provides evidence-based insights on how to build resilient healthcare to withstand future health crises and improve population health through policy change. The partnership has built and continued to expand upon one of the largest bodies of work on the sustainability and resilience of health systems globally. It has published 26 reports with robust evidence-based recommendations for policy change. Now, almost 50% of the healthcare-related carbon footprint stems from medicine use, doctor's visit, and hospital care, with the time patients spent in hospitals being the major driver of carbon footprint. So we've worked with the respiratory community to kind of calculate the poor sort of disease control of asthma and understand the impact of that poor disease control on the environmental footprint. And we saw data that says those patients with poor disease control of asthma incurs 3 times more of the carbon emissions than patients with good disease control. So to kind of deploy and scale solutions, we are partnering with governments and health systems to drive truly transformative and innovative solutions. Let me just quickly touch on 2. We've recently worked with the University of Glasgow and the NHS Scotland to enable an earlier identification and diagnosis of heart failure through a program we call Project Opera. The wait time for a specialist and an echocardiogram in this particular area of Scotland was 12 months. So imagine a potential patient with heart failure. That is not a good thing. So what we have done is leverage a digitally handheld device and also leveraging AI to automate the analysis at the primary points of care. And we reduced the lead time from 12 months to 6 weeks, improving the health outcomes of patients while reducing the carbon footprint. So the second one is a chronic kidney disease. We have a study called Impact CKD, where we evaluate data across 10 countries, including the US, to gain a view of the full environmental impact of CKD, including dialysis, medicine, and hospital stay. And we found that average across the countries, late-stage CKD, which is stage 5, involves 512% increase in carbon footprint than the early stages. So all this is saying the importance of early detection, early diagnosis, and the optimal treatment. My time is up, so to continue doing our part, we are working very hard to build new partnerships around the world and here in the United States as well. With the CDC Foundation, we began a sustainability partnership with the CDC Foundation to promote screening of high blood pressure in communities of color in Atlanta. We are also undertaking a lung cancer screening project with the California Medical Association Foundation to promote lung cancer screening to improve under-screening issues and reduce health inequities. So with that, I really, once again, thank you for the opportunity to be here. It is incumbent upon all of us here in the room and virtually to take bold action within our own organizations and work in and beyond our sector to address the climate health crisis. Thank you very much.
Okay, so I have the difficult job of coming in last, speaking after such an eloquent and distinguished, esteemed panel. But I will do my level best, and I'll try and stay disciplined within the 10 minutes. I'm using a backdrop because I wanted to be able to get you all to focus on a few important messages from the reflections that I'm going to share with you today. And I want to start off at the beginning by saying that why are we here today? This is about people. We've heard it time and again. The impacts are affecting everyone, and no country is immune to that. But the big question really is, beyond the epidemiological sort of links, how do we understand the impacts on people, and what is the cost of inaction? Because inaction is simply not an option. And I just want to perhaps get you to focus on these numbers. Pam spoke about the 130 million people that are going to be pushed into extreme poverty by 2030. And that's indeed true. But did you know that a third of that is actually being pushed by health-related impacts? 44 million out of that 132 figure that Pam quoted are actually driven by health-related impacts due to climate change. The second thing is, let's not also forget that, with all these climate extremes that we're seeing across the globe, many people have to leave their homes. They're displaced. So we are going to be seeing climate migrants in the order of nearly 1 billion people by 2050, with huge implications, obviously, on their health outcomes, huge implications on health systems, and obviously governments that are having to finance, such systems. Based on estimates that we also did in the World Bank, and this is really trying to take our understanding further on what was published back in 2014 using different dose response functions, we have estimated that nearly 27 million people would lose their lives by 2050, if we were to continue with business as usual. And by the way, just to reiterate, this is only based on 5 climate-related health risks: malaria, dengue, stunting, diarrhea, and heat-related illnesses. If we were to expand this to the broader set of impacts that we know of, including mental health, including air pollution-related deaths, we probably would be seeing a much, much bigger number than the one that is quoted here on the screen. And based on that assessment that I'm referring to, we also put a dollar value. We were trying to estimate how much is it going to cost economies moving into the 2030s and beyond, in terms of these lives that will be lost, and in terms of obviously the impact from different climate-related or climate-sensitive diseases. We're seeing more than $1.6 trillion just in 1 year in terms of economic losses. So these are extremely important figures. So with that, I think that the point is that we have to act, and in the World Bank we've been trying really to think about, well, how do we act? And I think the first or starting point for that is that solutions exist. It's not that we don't know what solutions are. There are solutions exist. We actually do know quite a bit of what can be done, mostly on the mitigation front, but we're learning as we go on what needs to be done on adaptation. A huge focus on human resource for health obviously is needed. A huge focus on supply chains is needed. But beyond that, there are so many different areas that we could be taking into account. So solutions exist. So what are we missing? Well, across the globe, the biggest part, and we've heard it from Naveen when he started his remarks, is financing. We know that the already constrained fiscal environments in governments across the globe are getting them really to spend less on health. This is one. Two, there's also a substitution effect because of certain priorities that governments are having to make. But if we were to encourage governments to, first of all, scale up financing using domestic budgets, that's the entry point. Before even talking about international financiers, DFIs coming into this space, this is about governments, and it's about prioritization within governments, and how they use those resources is going to be critical. It brings in also a lot of different dimensions around public finance management. How do we really take PFM into consideration as we talk about health and health budgets and formulation and execution of those budgets? I want to tell you a little bit about what we're doing here in the World Bank and how our focus has been. And this journey at the World Bank on climate really started scaling up back in 2015. All of us know that at that point it was the Paris Agreement. So many different governments obviously signed off on the Paris Agreement, and as well as some international development partners, and the World Bank was one of those. So what we did is we came up with a climate change action plan that defined the number of different steps that the bank would take. Later on in 2021, we updated that climate change action plan. And as you can see on the screen, this is where we currently stand. We have 6 commitments across the entire bank. I'm only laying out the 4 that relate specifically to the health sector. But the first one is ensuring that we are aligning all of the World Bank investments and operations with the Paris Agreement. This is on adaptation, resilience, and of course mitigation. We are trying to maintain a 50-50 split between adaptation and mitigation. In health, we've surpassed that. We're at 70% of our focus of our investments is on adaptation, 30% on mitigation, because of the fact that we're dealing with low-income countries that are actually not the biggest contributors to the climate crisis. We do know, however, that mitigation is important and it's good development, not just because of the carbon emissions, but because it's also about quality of care. It's also about efficiency in use of resources, and it's about cutting costs. So Paris alignment is huge and important, obviously, to us. The second thing is that all of our operations have to go through a screening process, and this is what we're referring to as the climate and disaster risk screening. This is really to ensure that we are sort of climate proofing all of our operations as we move into investments at a country level. The climate co-benefits is a third commitment. You probably heard about the bank's announcement that was also made at COP28. We have committed ourselves to increasing the share of our financing that's going towards climate action to be 45% of total World Bank financing. That's a huge game changer. 45%, nearly 50% of bank money, World Bank money, is going towards climate action. And at the same time, we're keeping our eyes on the results agenda. This is about ensuring that we can achieve what we've set out to do. So we're coming up with specific climate indicators that we're including at the moment as part of our results frameworks in projects. So all of that's great, but then how do we translate that to health? Okay, so the thing that we've then thought, okay, to be able to move forward on the climate and health agenda, it has to start by closing some of the knowledge gaps that we have at the moment across the globe. Things like what? Things like what my colleagues have spoken about in terms of understanding, for example, what would constitute the best and most cost-effective interventions. Naveen spoke about the big bets, and we're very much aligned on that, but there's also the best buys. What is it that would constitute those interventions that would give you the highest returns on investments is what we want to be able to move on. Getting an understanding of that is going to be critical, and this needs to be a collective effort that we do globally together to be able to push on that agenda. It is also about beyond the knowledge, because I'm mindful of time, I'm just going to give a few examples on each. It's about really working to support countries so that they could maximize finance and scale up action at ground zero. So this is about understanding vulnerabilities at a country level, from a climatology perspective, from a health perspective, understanding the adaptive capacities of health systems, and bringing in the financing to follow that through. And this is what we're focusing our attention on doing through a suite of diagnostics, as well as obviously technical assistance we're providing to client countries. And then the third part, which is extremely important, and that's why I'm really delighted that Dr. Chow extended this invitation to me together with Kaiser Permanente, that it's about partnerships. It is about bringing people to be able to come together at the same table to speak about the same topics and think about solutions. Now, let's not forget, it took us 27 years, and I'm repeating that again, 27 years to have a health day at COP. For God's sake, the climate crisis is a health crisis. We've been hearing this time and again. 27 years to get a seat at the table was just, it was a little bit too long, in my view. Okay, so my final remarks are going to be, well, what are we doing together then through these partnerships? In the lead up to COP28, we established the first Development Bank working group for climate health finance. This, in fact, comes in, and it shows the complementarity of how we're working across different institutions. It builds on the guiding principles that my colleague Naveen referred to for climate health finance that were also launched at COP28. But it takes us really into understanding the investment landscape. It takes us to really develop together a harmonized approach of thinking about a shared investment framework across development banks. And this is really to identify then sources of financing, what are the instruments that would be utilized to be able to scale up action, and how is it that we can get those finances closer to those that need it the most, i.e. the countries and the governments. So through that, what we've done is we've developed a roadmap. We've developed a shared investment framework, as well as a roadmap for action, which is what you can see at the bottom of this backdrop. It's a 6-step approach of how we think about investments. It comes in at the beginning by defining, in the first instance, what is it that we mean by investments? What are climate and health investments? If you're talking about adaptation, how do you define those? Mitigation, what are those? Moving from that first step beyond the initial definitions, it's about understanding vulnerabilities at country, national, subnational, regional levels so that the tailored solutions can come into effect in light of the results from that. It's about building capacity at a country level and ensuring that we're able to bring in the right sort of technical assistance in doing so. It's about obviously ensuring that the path towards action is set within governments and with the partnerships around that. And it's bringing in and mobilizing synergistic financing, including co-financing from different agencies. And lastly, and this will be my final point, the focus has to be on results. We have to ensure that we have the metrics. We need to know how many lives we're going to be able to save. We need to know how many people we're going to we're going to pull out of poverty as a result of our action. And we need to also know the amount of carbon emissions that we're going to be able to reduce with that action. So that I just want to say thank you again for the invitation, and it's been such a pleasure being a part of this panel.
Thank you. We do have time for questions. I ask that they be brief and that you refer to which of the panelists you'd like to respond, or we'll just throw it open. So who'd like to begin? Yes.
Good afternoon. My name is Joshua Rosenthal. I'm at the Fogarty International Center of the NIH, and I co-chair the NIH initiative on climate change and health. So inspiring panel. I'm really thrilled to see it. I have a specific question to Dr. Rabie. So we've spent decades trying to partner in one way or another with the World Bank and have found it challenging. The bureaucracies, the way that funding is done is really different. But perhaps even more important is the transparency that you've talked about in terms of, you know, the effectiveness of those interventions on health outcomes. Just not visible to the rest of the world. I know you have an enormous internal literature database, you have enormous staff competence, but I would urge you to reach outside to the academic sectors, to others that are not directly involved. There's an enormous amount of expertise. You know, we just spent a lot of time searching through the adaptation literature to look at the effectiveness of interventions. The World Bank must have an incredible footprint here. We found nothing. So those are lessons that we need to learn to be able to do our research, to improve health outcomes, to understand what adaptations work, where maladaptations are occurring, inevitably.
Tamer,
perhaps.
could you respond?
Thank you.
Thank you.
Yes, and I'll keep my response very short on this. I hear you loud and clear. I think that, you know, it's a collective responsibility that we have to ensure that data is out there and that there, you know, the research that we're all doing is leading to a common cause. So specifically on the impacts and the best buys, we are going to be establishing a consortium that will include academic institutions. And we're actually reaching out at the moment and trying really to find out who the main stakeholders in this space will be, working also with organizations like, like the Lancet and the Lancet Countdown to bring them into this space. So you'll be hearing more about this as we go further. But yes, thank you so much for the reminder that, academia needs to be also at the heart of this, and we value very much what you can bring, which we cannot. You bring in the academic rigor, we bring in more of the operational focus that builds on your rigor.
Thank you. Another question? Yes.
Sure, thank you so much. A very impressive panel. Is it on? Yeah, okay. And it just, as you've discussed, the leaps and bounds that we've made in health and climate and healthcare in just the last few years is quite remarkable, and it's inspiring and exciting. But I have a quick question in particular for AstraZeneca, Pam. The work AstraZeneca is doing, very, very impressive. But a question with respect to asthma management. You mentioned that in managing asthma, you can reduce emissions successfully by managing it well. And I've seen that NHS data, perhaps that's what you were referencing. But another piece of that data is moving from meter dose inhalers to dry powder inhalers. And I know that AstraZeneca has dry powder inhalers in Europe, but they have yet to come to the US for asthma. So can you say anything about why AstraZeneca has not brought your dry powder inhalers to the US yet?
Excellent. Thank you for the question, and thank you for your compliments of what we are doing as a company to make a difference. I think you're referring to, in the PMDI, which is the pressurized meter dose inhaler, there's a propellant in the inhaler that is obviously harmful to the atmosphere. And we need the propellant to deliver the medicine to the lungs of the patients, right? So I am really pleased to share with you, for many years now, 5 years now to be exact, we actually started on a project to replace the repellent with a near zero emission propellant. Now, it didn't exist because there's no such thing of a GMP near zero global warming potential propellant. We work with Honeywell, so we partner with Honeywell. We literally develop, we've gone through the scientific work, the technical work, the toxicity, and all the safety investigational works to develop this GMP grade near zero propellant. And I'm happy to say it's in clinical trials as we speak, and we expect to launch the PMDI with near zero propellant in 2025. So we're on it, and we're accelerating it. Thank you.
Next question.
Hi, how are you? I'm Jerry Abraham, president of the Los Angeles County Medical Association, was one of the co-authors of the AMA resolution declaring climate change a public health crisis and part of the Community Climates Network here. Really excited to hear this panel. I really appreciated Tamar's perspective that actually adaptation may be a lot harder than mitigation. In a lot of our heads, a lot of the advocacy we do is really around decarbonizing and reducing reliance on fossil fuels. I'd be curious to hear from y'all's perspective what types of engagement with other sectors, transportation, energy, and others, will it really take for us to improve the health of the public and reduce the health impacts of climate change? And I'd just be curious to hear your perspective on strange bedfellows and what would that look like, especially given maybe conflicts of interest or different goals we may have. And so do profits, for example, in healthcare impact our ability to accelerate the work that we need to do that many of you described today?
Let me take that and simply say that one of the major work streams of the National Academy of Medicine Grand Challenge is precisely that question. That is, how do we look at the most highly emitting sectors, energy, transportation, food systems, and agriculture, and integrate our approaches. There's a lot of effort now in the energy transition. There's some thinking about sustainable food systems, but there isn't really the creation of a global economic roadmap for how these interventions will interact with one another and accelerate, particularly when we look at their impact on human health. So stay tuned and join with us, because that is certainly a critical part of the initiative. I would say from John's perspective that that is what our government is trying to do across our various entities, and maybe you could comment on that as well.
Yeah, thanks, Sherry, for that question. And from a governmental perspective, I think that has been a big focus of the Biden administration, is an all-of-government approach. We don't have the conflict of interest, except for the usual silo versus silo wars. But there's been a lot of progress in that. Certainly on the mitigation front for the health sector, our office has been playing a key role of bringing in Treasury, energy, EPA, HUD, transportation, all together to help the health sector with the mitigation resources that have been given to the other agencies. On the resilience side, it's equally impressive in two fronts. One is there's been a really big push in the federal government to focus in a place-based manner on climate resilience. And there are multiple working groups that are really focused on place, which is inherently multi-sectoral, and how do we remove the barriers, how do we fight the silos. There's a lot of activity to have single point of contact applications for communities to apply, for example, overcoming some of these traditional government challenges. And then on the heat front, we have really been able to consolidate heat response efforts through interagency collaboration, through the National Integrated Heat Health Information System and interagency working group to bring together FEMA and CDC and all of those. So I think, from a government perspective, we've made a lot of progress. The funds come to us from Congress, and so Congress has a role as well in stimulating an all-of-government intersectoral approach, but I think we've made a lot of progress in the last few years federally.
So that train has left the station.
That train's rolling, and yes, it's left the station.
Another question? Yes.
Hi, Jessica Marks with NAM. I have some questions from the virtual audience. The first is not addressed to anyone in particular, but I think all of our panelists could perhaps answer. Could you speak further to what strategies or initiatives are being implemented to ensure that underserved or vulnerable populations and communities have equitable access to resources and support for climate resilience and health adaptation?
So obviously we are in the private sector. We have a part of our sustainability strategy includes a health equity arm. So effectively, what we are doing a piece of work right now with a goal that we will influence 1 billion people in the horizon, where it's really about how do we help the local health systems to have means to early detect and early screen, and to make sure that patients get treated early so that they have a better outcome. And a lot of that effort will be in the areas with a vulnerable population. Now, we think of sort of vulnerable population, we tend to kind of generalize them in certain countries, certain parts of the world. But truth to the matter is we have a substantial vulnerable population in the United States, living in the same cities and same states we live in, right? So we need to make sure that we don't just look in certain obvious parts of the world, but focus here right at home as well and say, how do we make sure every potential patient has the opportunity to be diagnosed early and to be screened in an effective manner?
So I'll answer that question in a few ways. First, from a Biden administration perspective, of course, we have the Justice 40 initiative, which is a really transformational effort on the part of the federal government to assure that resources are going to communities that are defined as being historically disadvantaged. And I'll just say of course, our office has not been given resources to give out, and so we haven't had to confront that personally within our activities. But HHS, when the Justice 40 program came out, had 2 of its programs designated as Justice 40 programs. We now have 13. And so HHS has been adding to that list of a number of different programs to make that commitment. So that's one way of answering. Second way of answering is that in broadening climate action to all of the Department of Health and Human Services, we are focusing on the health sector, but of course the human services side of HHS is the biggest grant-making. HHS in general is the biggest grant-making organization in the world, and most of that is coming on the human services side. And so the human services, the low-income home energy assistance program, the Head Start program, the aid to seniors, all of these programs are now incorporating climate resilience into their thinking, and you'll see that in our strategy supplements. So that's an historic mission. That's not so much a change. That's what HHS does. It's the safety net for low-income populations. But that is getting now informed by climate change. And then the last thing, but with all that, I think there's still absolutely going to be gaps and absolutely going to be communities that, are having trouble accessing the resources. One of the things that I hope will come through is this commitment I mentioned before to simplify the application processes. Because when I go out, and I encounter communities and the NGOs that serve disadvantaged communities, there's still gaps in capacity. There's still gaps in the ability of different communities to be able to reach the grants and the funding that has been dedicated to disadvantaged communities because of historical the lack of capacity from decades of disenfranchisement still persists. It doesn't change immediately and allow communities to be able to access it. So I think simplifying the application process, really doubling down on what is happening through, for example, the EPA TIC-TACs, the technical advisory centers that the EPA has stood up. It will take a little bit of time, but that's the last part of the solution.
Just want to add to that. I think spot on, both of you really talked about it. From our perspective at the foundation, we want to make sure that we work with the vulnerable populations in the most vulnerable areas and not just identify the problem, but work with them to identify the solution, to make it a locally relevant solution, to involve them in the co-development of the solution, and then have a commitment for capacity building so that they can then assume that solution and sustain it. So that's how we focus on it, that we make sure they're part of the conversation and they're part of the solution and that they're part of the sustainability.
What we've heard, if you just pull back from the specifics, is the critical importance of radical collaboration and radical partnering, and how important that is at this intersection. I think the second major theme, aside from the community-based, place-based intervention, because that requires action, the second is obviously financing and new mechanisms for financing. But if we don't think in silos, we can get more bang for the buck. So it isn't just a single intervention producing a single outcome, but these kinds of framings allow us to ask how we can really get accelerated impact by either leveraging the resources in different ways or always asking, what is the climate impact? What is the health impact? And screening those that aren't the best bets and the biggest buys. Really thinking in an industry like ROI perspective. The third thing that I heard listening to our panelists was the new ideas that come in health products, in new kinds of interventions, if you put a climate lens framing on it, and reciprocally, the new kinds of approaches to climate interventions if you put a health lens on it. And so there's lots of interesting, energetic, new thinking that can come from this nexus. It's not only thinking about the impact of climate change on human health, although that is quite significant indeed. So those are my takeaways. Thank you to our extraordinary panelists. Thank you.
Well done. Really well done.
How about another round of applause for the panel? Well, we're off to a great start. Judy's concluding remarks are spot on. I think the whole purpose of creating this panel is to illustrate how much is going on and then how public-private collaboration is important. So you heard from government, from the bank, from private sector, from foundations. Of course, rest of the day, you're going to hear a lot more about this, and the same subject will come up again, except we're going to illustrate more examples of how people are doing this. And most important, how we're going to all work together. That, in fact, would be my remarks following the next speaker.